Good afternoon. My name is Dr. Corinne Kyriacou, and I am the co-director of public health programs here at Hofstra University. And today we're going to be talking about the Advanced Certificate in Foundations of Public Health. And before we start, I'd like to introduce my colleague, Nicole Tuminelli, who's with us. She is the Assistant Dean for External Relations and Recruitment. And so once we get through the slides, you can ask questions of either myself or Nicole about the process for application and financial aid and other kinds of procedural tasks. Okay, so I thought I would spend just a couple of minutes talking a little bit about what is public health, just to orient everyone. And I'm sure many of you who are on the webinar are well aware. But just as background, public health is an interdisciplinary field that focuses on prevention primarily and finding ways to ensure that all different levels of society are engaged in mechanisms to prevent injuries and illness and premature death and to promote health and wellness. Our overall goal is to ensure that the population has access to not only healthcare services but other kinds of services and infrastructure and environments that promote health at all levels, at the community and population level. And it's really what we do as a society to collectively assure conditions to remain healthy are available for all people. This slide kind of goes over some of the top achievements in public health over the years, and clearly this isn't an exhaustive list, but it does represent some of the most well-known achievements in public health, from vaccination to safer workplaces, family planning, safer and healthier foods, recognition of tobacco as a health hazard. Really, public health has been instrumental in moving our society forward and ensuring that our population is on a path to become healthier and healthier. The core functions of public health can be subsumed in this way, looking at this slide. Really what public health professionals do is engage in assessment, policy development, and assurance. And embedded within those domains is a focus on monitoring health and ensuring diagnosis and investigation of illness and disease is happening, to inform and educate and empower individuals and communities, mobilizing community partnerships, developing policies that help to ensure that populations have access to safe living spaces and safe food and water and healthcare, to enforce laws and ensure that the workforce is competent. And all of that happens within a context of evidence. So research is at the core of this wheel and really does inform all of these different activities. The core disciplines included in the public health field are the 5 that are represented on this slide: biostatistics, epidemiology, environmental health, social and behavioral sciences, and health policy and management. And as you can see by these definitions, what the focus here is on making sure that there is an understanding of data, a use of data to drive policies and programs to help us understand the distribution and determinants of disease and disability in populations, to help us understand issues associated with adverse chemical, physical, and biological agents in the environment and their impact on human health, and to make sure that when we are developing policies and programs, we are selecting, applying, and monitoring appropriate behavioral, social, and political strategies, that we're recognizing the social and behavioral determinants of health, and then to better understand how healthcare systems and how laws and the organization, management, and financing of healthcare services affects access to services and affects how programs and policies are delivered. And then there are a series of cross-cutting domains that really drive the public health field and are critical for all public health professionals to have competency in, and that is analysis and assessment, as well as policy development and program planning, communication skills and understanding and ability to operationalize cultural competency, understanding the community dimensions of practice, financial planning and management, and leadership and systems thinking. And we'll talk a little bit more about that when we talk about the curriculum. Public health can be practiced in a variety of settings. Listed here are just some of those that are places where not only do most public health professionals practice, but where many of our students and alumni go on to practice public health. So it could be at governmental levels, in private practice, both for-profit or nonprofit agencies, in schools or universities, health policy and advocacy organizations, global organizations, and professional health agencies. So let's just talk now for a minute about why would somebody go for an advanced certificate in foundations of public health. The certificate, which is relatively new here at Hofstra, offers graduate level courses to equip professionals with the skills and knowledge of evidence-based approaches used in the profession of public health so that individuals can engage in the kinds of activities I just mentioned on the previous slides. After completing the certificate program, individuals will have the foundation needed to either begin the Master of Public Health degree at Hofstra or to pursue additional professional pathways. The advanced certificate is intended for a number of different audiences. One would be public health practitioners who are already working in local, state, or federal departments and who are looking for additional tools and skills to better equip them to do their jobs. Or health professionals who are working in community or non-governmental agencies or hospitals or other healthcare facilities who, again, need additional strategies, perhaps more research skills to advance their careers. And also for students who are interested in eventually pursuing the Master of Public Health degree but are unable to enroll for various reasons at this time. And it should be noted that if you do complete the advanced certificate in Foundations of Public Health and then you choose to enroll in Hofstra's Mph program in the future, all credits earned in the advanced certificate would count towards your Mph degree. So for folks who are thinking about an Mph degree directly, it's important to recognize that this is the most widely recognized professional credential for leadership in public health. And it enables students who complete the degree to understand and apply public health theory and research methods for the purposes of improving community and population health. It's often paired with clinical or other degrees, although it also is considered a terminal degree, as there are many career pathways available for those with an Mph degree. Just to give you a little bit of an orientation of where the advanced certificate in Foundations of Public Health and the Master of Public Health programs sit, we're in Hofstra School of Health Professions and Human Services, one of the newest schools here at Hofstra and one of the fastest growing schools. There are 3 departments presently in our school. One is the Department of Speech, Language, and Hearing Sciences. The second is the Department of Counseling and Mental Health Professions. And the third is the Department of Health Professions, in which the Mph and the Advanced Certificate in Foundations of Public Health reside. Other programs in our Department of Health Professions include undergraduate programs in health sciences, community health, athletic training, and exercise science, and other graduate programs in health administration, sports science, occupational therapy, and health informatics. And as you can see, there's a focus in our department on population health, the importance of strategies aiming at improving the health of communities. Some fast facts about Hofstra's Advanced Certificate. Like I said, it's a relatively new program. We just established it in 2017, and it was established really in response to what we heard from our community advisory board and other community partners, that there was a real need out there for folks who could come in and build a critical set of skills that would enable them to be better able to work in the field of public health. And it had to be quick. It had to be something that folks could come in and complete in a year, that it wasn't going to take 2 years. It wasn't going to be expensive. It wasn't going to have, 42 credits like our Mph degree has. And so we developed this advanced certificate, and we thought about what are those critical skills that we think could really propel individuals into positions in the field of public health where they could really have an impact. And so it's a 12-credit program. There's also a 0-credit seminar that is included. We are taking in about 4 to 5 students each year. There's 1 to 2 classes that can be taken each semester. There are 4 full-time faculty associated with the public health programs here at Hofstra. So that means those same 4 full-time faculty and 20 practitioner or adjunct faculty serve both the Mph students as well as the advanced certificate students. Our practitioner adjunct faculty come from Northwell Health and other area health systems, as well as from within Hofstra in other schools and departments such as psychology, sociology, law, and medicine. And we are a member of the Association of Schools and Programs in Public Health, ASPPH, which helps to keep Hofstra's programs engaged with the national dialogue about what's happening in public health and how can we better serve populations. Some fast facts about Hofstra's Mph program. It too is relatively new, established in fall of 2012. It's a generalist program. We do not offer any tracks, and we do that on purpose. We feel like the healthcare system right now is so dynamic and changing that it's really critical for folks who want to pursue leadership positions in public health, have a solid foundation across those core disciplines that I mentioned previously. And so we want everyone to come in and kind of get a solid understanding of biostats and epi and the social determinants of health and environmental health and health policy and management. And there is an opportunity to specialize in a way through the selection of specific electives and through the focus in the required internship and culminating experience, which I'll talk about in just a few minutes. The Mph program does have 2 dual degree programs, one for Hofstra's medical students and one for Hofstra's law students. It is 42 credits, as I mentioned previously, which translates into 14 classes. We enroll about 30 new students each year. And as I mentioned previously, we do have 4 full-time faculty and 20 adjunct faculty. We're a member of the Association of Schools and Programs in Public Health, and we're also accredited by the Council on Education in Public Health, which is a really critical standard that ensures students that our curriculum has been quality tested and analyzed and reviewed at the highest level. The mission of our public health programs is to educate engaged, committed, socially aware, culturally competent, ethical public health researchers, practitioners, and policymakers for the purpose of meeting society's needs to prevent and ameliorate public health problems locally, nationally, and globally. And I like to say that what we're really doing is training scholar practitioners. We're training folks who have a really solid understanding in research and data so that they can drive effective programs and policies. Our advanced certificate curriculum is competency-based, meaning that we're focused very specifically on a core set of skills that we want students in this program to develop. In that first semester, most students will take 2 courses plus the 0-credit seminar, which is an introduction to the foundations of public health. The other 2 courses are social and behavioral determinants of health and program planning and evaluation, and I'll speak a little bit more about what each of those entail in just a minute. And then the second semester, students in the advanced certificate would take epidemiology and biostatistics. The Foundations of Public Health seminar is described here on this slide, and as I mentioned, it does provide this basic overview of public health, of how interdisciplinary in nature public health is. You'll review key historical moments and developments and models and frameworks for understanding health in populations, and look at some of the primary problems, primary concerns that we're facing right now, such as infectious and chronic disease, as well as health disparities. The course engages in an analysis of a series of case studies of significant public health challenges and achievements, really to help students understand how public health works, and how it has been successful at transforming the health of groups by working at multiple levels of various facets in society. And also standards for ethical practice will be reviewed. The social and behavioral determinants of health course help students understand how individual behavior, family and social networks, as well as cultural practices and social factors all influence health. Oftentimes we think about healthcare access as meaning that individuals need to have access to insurance in order to be healthy. But we know that what insurance does is provide coverage for healthcare services. And as important as healthcare itself is, it only drives a little bit of what ultimately goes into the production of health. Social and behavioral determinants are so much more powerful in that overall production of health, and they must be considered when we're talking about access and education and knowledge. And this is what this course will focus on. Mph 205 is the Public Health Program Planning and Evaluation course, and it's really a critical course. It's one of the ones that we knew right away we would include in this advanced certificate, because in this course, students will gain an understanding of the various components and strategies required for developing health promotion programs. They will be able to engage in the planning process, understand the whole implementation stage, think about how to develop appropriate interventions that are tailored to specific audiences, think about outreach strategies, timeline, budgeting, evaluation, and figuring out really how to map the goals of a program to the outcomes. And it's really a critical set of tools that students will leave the course with. In the second semester, students will take Epidemiology One, which will provide an introduction to descriptive and analytical epidemiology, which means that students are going to learn about epidemiologic data, how to calculate and apply measures of morbidity and mortality to describing and analyzing the health status of populations. Students will become familiar and comfortable with understanding epidemiologic study designs, bias and confounding, and what goes into making causal references using such data. Just as in the social and behavioral determinants of health course, in this course, students will be analyzing research studies so that they could better understand the process for designing those studies, as well as what those results and findings actually mean. In the Biostatistics One course, students will be provided with an overview of biostatistics theories and methods commonly used in public health sciences. They're going to learn how to conduct descriptive and univariate analyses of data from public health and clinical studies and how to interpret those results, which is really critical for those working in the public health field, because as I mentioned when we first started, so much about what we do requires that is based in evidence. And in order for us to use data to drive programs and policies, we need to understand it. We need to be very comfortable with both designing as well as evaluating the designs of studies and interpreting the results. Just a little bit about how the Mph curriculum differs. On this slide, what I've highlighted in blue are the 4 courses that are similar between the advanced certificate and the Mph degree, but I wanted those participating in the webinar to understand what else goes into the Mph degree. And so there are courses that introduce students to public health and the U.S. healthcare system. There's an additional lab for biostats and epi, which is actually optional for advanced certificate students. There's courses in environmental and occupational health, as well as specific research methods courses for quantitative and qualitative studies, and an intro to global health issues. In the Mph degree, students are required to complete an internship and leadership seminar, as well as a culminating experience, which they complete at the end of their studies, and it demonstrates the student's competency in beginning and completing a research project. So the planning stages, going through the collection or analysis of data, reporting on that, putting it all together, and discussing what are the implications for research policy and practice going forward. And then there's a list of electives, which is always growing and changing. We often tap into our students as well as our community partners to better understand what are some of the other issues we should be developing electives around. These are just some examples of internship sites where Mph students have completed their practicum, their applied experiences. You can see that there are both local areas here, like the Nassau County Department of Health, as well as health systems, and there are placements in the city. Again, this is not an exhaustive list, but it's just an example, and we have had most years a team of students who have also completed a global health internship. On this slide, it's a lot of text, but I wanted to provide you with the titles of the 2018 Mph culminating research projects. As I mentioned just a slide or two ago, all Mph students are required at the end of their studies to complete a project that they design, that they identify, and that they direct through the data collection, analysis, and reporting stage. And this helps the students better understand not only how to tie in everything they've learned across the curriculum, hence the name culminating experience, but it also helps the faculty ensure that they've reached the level of competency that we're looking for our Mph students to reach. And so what I love about listing all of the project titles is it really helps audiences to understand the breadth and depth of what public health is. And who our students are. We have a very diverse student body, both in terms of where they come from, but also in terms of what their interests are. And as you can see through these project titles, we are covering topics as widespread as the opioid epidemic, to silver diamine fluoride to prevent cavities, to improving pre-hospital notification for stroke patients, and many others. This slide gives you just a little bit of a selection of some of the co-curricular activities that we have here at Hofstra for our public health students. We take it very seriously, this idea of co-curricular education. Not only are we looking to meet certain standards within our classrooms and our courses, but we also want the students to leave really understanding what it means to be a public health practitioner. And so we create a number of opportunities, and we also link our students to existing opportunities that exist around campus as well as throughout the region, where they can really practice the skills they're learning in the classroom. And so there are a number of service opportunities that our students engage in. We provide various additional trainings and workshops as listed on the bottom left of the slide. We also will bring students with us to conferences. We will hold our own conferences here on campus, journal clubs, lectures, discussions, panels that we will invite students to either observe or participate in. Here's just a couple of pictures of some of our students engaging the community in health education and promotion through health fairs. A couple of additional slides of our students engaging in activities. Every year we hold a National Public Health Week conference, and one of the events at that conference is a student film competition where students develop public service announcements around health topics, and they work on teams with students from disciplines across campus. And so you can see in the top right, we have quite a large group focusing on various pressing issues in public health. The bottom of the slide is a picture of our students helping the Nassau County Dental Society develop a tracking system for their free dental screening program called Give Kids a Smile. And our public health students have engaged in that service opportunity for the last 4 years. Here's a list of where some of our Mph alumni are. We actually have our first alum from the advanced certificate, and he'll be starting medical school this summer. And so I put that in blue. But clearly we have more alums coming out of our Mph degree because it's been around longer. And these are just some sample positions and organizational affiliations. Here is a slide about the admissions requirements. For the advanced certificate, we will need official transcripts. We're going to be looking for folks who have earned their bachelor's degree with a minimum GPA of 3.0. We are going to be looking at the resume very closely to see evidence of interest in social justice issues because that really forms the bedrock of public health and drives public health professionals. And we'll be looking for 2 letters of recommendation that offer evidence of ability to do graduate level work. Those requirements are also part of the Mph degree requirements, which is a little bit more extensive. That also requires a personal statement where we're looking for a deep understanding of an interest in public health and becoming a future leader. And we're looking for 3 letters of recommendation as well as a competitive score on the GRE or other graduate entrance examination. We do accept the MCAT, the LSAT, and the GMAT. In terms of the application process, it's fairly straightforward now. You can self-manage that process online through hofstra.edu/gradapply, which will take you either to Sophus Express or to Hofstra's graduate application system. For the Mph degree, all students do need to apply through Sophus. And again, both of those can be accessed by typing hofstra.edu/gradapply. We have rolling admissions, which means we are continuously reviewing applications and accepting students in both the fall and the spring for both the advanced certificate as well as for the Mph. In terms of financial aid, the majority of our graduate students are eligible for federal financial aid, and that holds true for both the Mph as well as the advanced certificate students who are taking a minimum of 4.5 credits each semester. We do have a few merit-based small scholarships for exceptional applicants, which the admissions committee will determine upon review, and those come directly from the program. And a number of our students find paid work on campus. There are graduate assistantships, not in our department, actually not in any of the academic departments. They're typically in the administrative departments, such as event management or graduate admissions. These graduate assistantships are very competitive, but they do come with full tuition in exchange for, I think, 15 hours of work or maybe 20 hours of work on campus. Students can also work as research assistants for faculty and receive modest stipends. And again, that would be once a student was accepted into the graduate program or the advanced certificate, they could then connect with a faculty member to talk about their research interests and whether or not there were research assistant positions available. And the last slide just provides some key contact information, both for myself. You have my phone number and my email, and you can email me directly with any questions. My co-program director for public health programs is Dr. Hackett, and her phone number and email address is listed there as well. And as I mentioned before, with me today is Nicole Ciminelli. She's the Assistant Dean of Recruitment and External Relations, and her telephone number and email is there. And lastly, but certainly not least, I would strongly encourage, if you haven't already, to please visit our website, and the website is listed there because on the website, not only do we have student and alumni testimonials, but you can learn more about the faculty in the public health programs, as well as some of the events that we engage in, some of the conferences that we've held. You can learn more about the curriculum. There are links to the bulletin, and certainly more about the admissions criteria and process. So if anyone has any questions, we can take them now. Okay, so one question is, How could the advanced certificate help me in my job? And I think the best way to answer that question is really it depends. So it depends on what kind of job you're in. As I had mentioned earlier, what the advanced certificate will do will give you a very specific set of skills. And those skills are skills that are marketable. We know that from our community advisory board, our community partners, and from various conversations we've had with internship supervisors and preceptors in the field, as well as our alums. We know that organizations in the field engaging in various kinds of public health activities are looking for students who understand how to develop programs, who understand how to analyze data, who understand how to use research to make decisions about programs and policies. We know that the field is looking for students, graduates with evaluation skills. We know that the field is looking for students that have an understanding of how to budget for public health programs. And these are the kind of tools that we will give you through the advanced certificate for your toolbox. So it seems, both in my opinion, as well as based in evidence from conversations that I've had with multiple stakeholders, that the kinds of skills you'll develop in the advanced certificate will certainly be marketable and of interest to organizations engaging in a range of public health activities. Another question that's come in is, why would somebody go for the advanced certificate versus the Mph degree? And I think, again, that's a good question. I touched upon it a little bit earlier in the webinar. The advanced certificate is really targeted to, multiple audiences. One of them are folks that are currently working in the field, and maybe they're very happy in their jobs, but they feel like they need a refresher, or they need, a new set of skills to help them perform at a higher level, and they want to better understand, data or analysis. They want to better understand the mechanisms for tracking and understanding the determinants of disease. Maybe they're working in an organization that does require them to write grants, and they want to understand what that process involves. They want to be able to develop programs and interventions. And so those folks will be able to come in and in 1 year with 12 credits and a reasonable amount of time and money be able to really build a set of skills that will enable them to perform at a higher level in their jobs. Other folks may want to come for the advanced certificate because they're looking for promotion within their field, within their organization, and they want to be able to demonstrate that they have a higher level of understanding of research and analysis and program planning. And so you would get that through these core courses in the advanced certificate. And then some students may be thinking about the Mph degree, but just really not ready at this point to commit to a 42 credit master's level program, and may want to first just see how it goes. Maybe they have a lot of other kinds of personal responsibilities. Maybe they're concerned about, the finances and the time. And so they want to come through and get, an advanced certificate that could be applied eventually to an Mph degree. So there are lots of different reasons why someone would start with an advanced certificate before going right into the Mph degree. And the last question I think we'll take is whether or not students who are accepted into the advanced certificate eligible for financial aid. And as we had said before, if students are taking a minimum of 4.5 credits, they should be eligible for financial aid. They're also eligible for our new student scholarships, which are modest, but and usually provided, to exceptional applicants. But the advanced certificate students and the Mph students are both eligible for those two different kinds of resources. And this is not a question, but just one last comment that I didn't mention earlier. I just want to make sure that people are clear that we are having the advanced certificate students sit in and engage with the Mph students. So it's all, all together. We're building a community of scholar advocates for folks who are social justice practitioners, regardless of which program they're coming into the classroom from. So with that, thank you so much for your attention, and I hope to hear from some of you directly by responding to my email.